When writer, blogger, holistic health coach Jessica Ainscough was diagnosed with advanced epithelioid sarcoma in her left hand, arm, and armpit in 2008, and then a relapse of cancer in 2009, her prognosis was grim, 50% chance of survival in 5 years. Doctors recommended amputation. Although in 2008, Jessica had an isolated limb infusion with a super high dose of chemotherapy, in 2009, she opted for natural alternative cancer treatments. She started the Gerson therapy, a strict and rigorous regime of hourly juicing, round-the-clock coffee enemas, and a vegan diet. She also overhauled her lifestyle and went from eating meat, refined carbs, and processed easy meals to organic, plant-based whole foods diet. She went from taking no supplements to taking a regimen of wellness-supporting natural supplements. She started meditating, yoga, and daily sunlight exposure. Has she ever cheated? No. She cut out all meat, dairy, bread, salt, and refined sugar, her indulgence, raw honey, whole fruit, apples, and fresh juices. She now lives on the Sunshine Coast in Australia and nourishes her spirit by blogging. She does not fear death. She says, "What is the point of fearing something that is so inevitable?" She attributes her survival to juicing, diet, coffee enemas, supplements, meditation, and emotional healing work. 50% chance of surviving, thriving 2 years later. The Thrive Channel congratulates Jessica Ainscough, ultimate survivor. I am a breast cancer survivor, a blood cancer survivor.
I'm Dr. Holly Lucille, a naturopathic doctor.
I am a mom of a teenager, basset hound owner, military wife.
My name is Dr. Deanna Atai, and I'm a breast surgeon.
I am a cancer survivor who is looking for answers just like you.
I'm Deborah Tripathi. I'm a medical oncologist.
What works, what doesn't? Welcome to Thrive with Namrata. I know we've covered this in a different show in terms of alternative treatments in cancer, but my big question is, really, where do these treatments lead us when we try to make them evidence-based? I'd like to start with Dr. Tripathi, who was instrumental in actually being a part of the first Tibetan medicine study for breast cancer, metastatic breast cancer patients in the United States. I would like to know from Dr. Tripathi what the results of those trials were and what your general thoughts on alternative treatments for cancer in general are.
Well, we did a study about 15 years ago looking at Tibetan medicine and Tibetan herbs for women with advanced breast cancer, getting that as their only treatment. So these were women that didn't have much in the way of symptoms and had already progressed on standard treatments. And it was a pilot study. We just wanted to see if it was feasible and safe. And so we had Yeshe Dandan, a Tibetan physician, use his diagnostic skills to then compose a Tibetan formula. We actually got an investigational new drug license from the Food and Drug Administration to do this. So it was a completely above board study. And what we found is that it was safe and feasible, but it wasn't really a study large enough to see how many patients would respond. We did see one patient who had tumor shrinkage. Most of these patients over time did end up having progression of their cancer and unfortunately succumbing to their disease. But this trial wasn't designed to see if it was effective. What we need really is larger studies to see if maybe in addition to standard treatment, perhaps, Tibetan medicine could be effective. So these are the kinds of studies that need to be done to study and to understand which of these modalities in cultural medicine throughout the world that are very different from what we use in the West might actually be effective, not so much instead of standard treatment, but perhaps when added and blended in with standard treatment.
Yeah, I think it's important to distinguish the terms alternative therapy, which usually means instead of standard therapy, versus complementary or an integrative approach. And I think most of us, just based on our training and our experience, are firm believers in evidence-based standard therapy, but definitely know that there is a role for treatments from other disciplines, whether it's Tibetan medicine or Chinese medicine, Ayurvedic medicine. I mean, some of these disciplines have been around for a long, long time. And we can hopefully use some of that information to help either improve outcomes or at the very least manage side effects and improve quality of life.
I think there's value in all systems of medicine, and I think what's really important in this particular case, I say, you know, it's not about the agent, it's about the approach. Okay, so let's say it's not about all of the evidence-based studies for anti-cancer on curcuminoids, the active ingredient in turmeric and curry, right? But it's about looking at somebody in a very comprehensive way. It's the approach, being able to identify and treat the cause, being able to treat the whole person, being able to first do no harm. So can you use lifestyle modifications, dietary interventions first before we go into more invasive drugs and surgery? And once again, then can you use them together? So chemotherapy, very toxic intervention. Can we use certain evidence-based, well, shoot, it's just food, amino acids, glutamine, et cetera, to actually protect the body from the cells that we don't want destroyed, right? From the damaging effects of chemotherapy. So it's about the approach, not the agent. I understand conventional Western reductionistic medicine in cancer treatments, but I think we can round it out a bit.
So looking at these numbers from the Tibetan study, Dr. Tripathi, it looks like 11 out of the 12, at least the last time we checked, and we don't know what happened with patient number 12, unfortunately didn't make it. And so the question that comes to mind, what you said, Holly, right now is, try these treatments before you try the more invasive treatments. The question is, do you really risk a person's life by not giving them treatments? This is a big question that came up, by the way, in our survey. People saying, well, should I try alternative treatments before I try conventional treatments? Are you, as a doctor, willing to put their life potentially on the line and trying out something less invasive first, as a Steve Jobs did, with potential harm?
No, I certainly would never put myself or a patient in that situation, and that's not what I'm saying. I think when I say, first do no harm, I think concomitantly, if we can look at identifying and treating the cause, all the contributing factors, getting somebody's story around their tumor, around the diagnosis, the development of the disease. But I think it's really important to understand and refer to experts, certainly as diagnostic experts, so that we can have appropriate treatment options. I would never encourage anybody just to turn a blind eye to conventional Western cancer treatments, because they might absolutely be necessary.
Jessica Ainscough, thank you for being an ultimate thriver. We'll see you next week.